Most ladies have fibroids and they are not even aware that they have fibroids. Most ladies know that they have fibroids and they are feeding the fibroids. This is why most of the times when you've done surgeries, afterwards they say it's reoccurs again. Now, a lot of times too, those that don't even know that they have, in fact, as a lady, even if they say you don't have fibroids, you checked your womb, you have to be very careful because it can occur at any time, especially if you are an African woman. So in this video, I'm going to be telling you how to deal with fibroids, how to treat it naturally, and then of course the surgical way, and then how to foods that you can eat that can shrink it. Basically, we're talking about fibroid management. But before that, we'll have to discuss about fibroids, the causes, risk factors, prevention in case you don't have it. Then if you have it, what will you do? And then I'll give you what we call the fibroid diet, so that you can, that's why when they say you have fibroids, over time you start, they start saying it's getting bigger and bigger. Meanwhile, some people can have their fibroids and it doesn't get bigger, rather it even shrinks, and they can carry their babies and that's it until they are ready to remove it surgically. So my name is Nurse Merit. I'm a nephrology nurse. Basically, dialysis kidney is my specialty. If you have questions, please put them in the comment section. To have a one-on-one consultation with me, please chat the number on the screen. Tell them you want to speak to Nurse Merit. If you want a gynecologist, we have neurologist, nephrologist, cardiologist, any kind of doctors you want, we have, and you can consult with them one-on-one on WhatsApp call, and then they can send you to do text, give you prescription or diagnosis, or refer you if it's a surgical case. Now let's get to it. What is fibroids? Fibroids are abnormal growth that develops in or out of the uterus. So it can develop in your uterus or outside the uterus. Now fibroids can get bigger and bigger until it starts obstructing blood vessels. If fibroid, okay, we'll be talking about side effects of not doing anything to your fibroids at the later end of this video. So if your fibroids, you didn't do something, those that needs to be removed or not, it can cause a major damage to your organs like your kidneys. It can damage the kidneys and a lot of things, and or you can even bleed to death. Now there are different kinds of fibroids. Please, the kind of fibroids you have is very important in the management, so please listen attentively. Number one type of fibroids we have is the intramural fibroids. Now, the intramural fibroids, they, grow in the muscles of your, uterus. So if you have an intramural fibroid, it has the capacity of growing larger because it's a muscle. Okay. Now, we have cervical fibroids. This type of fibroids are rare. It develops in your cervix and, connects from your cervix to the vagina or to the vulva. Just the vagina, I beg your pardon, because the vulva is the outside part. Now, another one is subserosal fibroids. Subserosal fibroids forms outside of your uterus. So these kind of fibroids can make your stomach grow big, and this is the kind that they will tell you have your babies can, won't have any issues. Okay, so but it makes you, your stomach grow big because they develop outside of your womb. That's the uterus. However, as they are growing, your uterus is also enlarging. We have other kinds of fibroids, pedunculated fibroids. Let me not just bore you with this. Now, fibroids can be known as this name. So in case they told you any of this, just know that it's fibroids. It could be uterine fibroids, it could be myoma, it could be uterine myomas, it could be fibromas. Any of these, just know that they are talking about fibroids. Now, causes of fibroids. Well, most of the times they are no, you can't just say these are the causes of fibroid, but there are some risk factors which I'm going to be mentioning. Please listen attentively. Number one is hormones. Okay, now this has to do with hormonal imbalance as a woman. If you're having hormonal imbalance where hormonal imbalance, okay, as a woman, this is why if you're not seeing your period, you're on your period days, 2 months, 3 months, you've not seen your period, this is not a good thing, because when you don't see your period, these two hormones, progesterone and estrogen, they are the two hormones. The build-up of these hormones are the main cause of fibroid. So now these two hormones make you see your period help the walls of your uterus to shed off. So what happens is that before you start seeing your period, the walls of your uterus is thick. Okay, is thick. So these hormones now make you to shed when there is no fertilizer, when you didn't get pregnant. These hormones now make the walls to shed off, and it sheds off in form of menstruation. So when you don't see your menstruations, these hormones are built up. Even the walls of your uterus is thick, and this can cause a condition called endometriosis. Now, because of this buildup of estrogen, progesterone, it can cause fibroids for you. Now, there are also foods that can cause these fibroids for you. Why do they cause these fibroids? Is because they promote estrogen and progesterone a lot, especially estrogen. Okay, they are not germinated by your body. We'll get to that point. So what you need to know is that hormonal imbalance, that's hormones, excessive of these hormones, when they are not absorbed by your body or used by your body, can cause fibroids. Another most classic cause of fibroids is there's been a link that genetic factor. So people that have had it in the past, like it runs in your family, your mom has had it, your sisters, there's every likely chance that your daughter or you may have it. So this is best that you know, so that when you know, then you start preventing the things that can cause you from having fibroid in the nearest future. Now, having talked about this, there are some lifestyle that can make you have fibroids. Okay, for instance, weight gain. When you add on this a lot of weight, it can make you increase the risk of you having fibroid. If you eat carbohydrates a lot, you sedentary lifestyle, you don't do exercises, you don't work out, you just eat carbohydrates, carbs, making you add weight, disrupting your hormone, you are in risk of having fibroids. Now, African women are also at risk of having fibroid. Now, this is where relaxer comes in. There's been a study linking that this relaxer women use increases their chances of having fibroid because of the estrogen. I don't know how this is linked, but it's there. So as a lady, if you're looking for a reason not to keep virgin hair, or of keeping virgin hair, maybe you don't even know why you're keeping virgin hair, one of the reasons that is good for you is running away from fibroids and hormonal imbalance. Now, how is fibroid diagnosed? How do you know you have fibroids? If you've been watching this and you don't even know if you have fibroids, one of the ways to know this is through a pelvic exam by your gynecologist. Another way is ultrasound. Okay, ultrasound will find out, check your abdominal organ, check your pelvis, and find out if you have fibroids. And then sometimes it can help find the size, shape, location. And then transvaginal ultrasound is like a probe. This is more accurate. Also, even pelvic MRI, there are so many tests that can find out if you have fibroid. Now, what are the symptoms that suggest that you may be having fibroids? Number one, excessive bleeding. If you notice that your period lasts more than 7 days, please, this may be a sign that you're having fibroid. Now, or your period is like seriously bleeding, is heavy. You know what a heavy mens is. In the next 1 hour, 2 hours, in the next 1 hour, you're soaked already. Okay, this may be a sign that you're having fibroids or hormonal imbalance, especially fibroids. Or let's say that painful sex after having sex is, there are other things that can cause painful sex in women. Locate the video of painful sex in women here. I'll put the link on the description box to find about more about painful sex in women and how to stop it. Vaginal dryness, hormonal imbalance, especially hormonal imbalance. Please locate that video. It's for every woman. Hormonal imbalance. Just check the description box. You will see the videos I put there that are related to this video. It will help you a lot. So another symptoms is that you're having serious abdominal pain or pelvic pain. That's menstrual cramp kind of pain, but it's serious. If you're having severe menstrual cramps, please, this may be a sign of fibroids. Okay, please, serious medical cramps is a symptoms of fibroids. So please not just fibroids, hormonal imbalance, endometriosis, PCOS. So please, menses shouldn't make you not to do what you're supposed to do. It should just be there mild. But if this is often, you're rolling on the floor like you want to die, go and get yourself checked by a gynecologist. We'll have one. Chat the number on the screen to, consult with a gynecologist. He will ask you to run some tests, look at it, check your hormones, and then prescribe. But before then, you also do some of the things I'll be mentioning in this video. So extreme pain, back, abdominal pain, pelvic pain, it's a sign. Then if you're having recurrent, probably PID, pelvic inflammatory disease, please go and get yourself checked. Find it difficult to treat PID, I have a video here that can help you as well. And of course, if you want to consult with a gynae, same thing. Now let me not just go so far. What are the treatments for fibroids? Now it all depends. There are medical treatments, there are surgical treatments, and there are natural treatment, which I will be telling you about the natural treatment. But for the purpose of this video, the medical treatments are, if it is in the case of hormonal imbalance, your doctor will prescribe some medication for you, progestin. It depends on the hormones that are imbalanced. It can come in pill form, injection form, or so. Just know that there are medical management to fibroid. It now depends on the type you have and what is causing yours. So yours is very, very important to know what is causing it. Remember, food has a lot to do with fibroids and hormonal imbalance. Make sure you watch that video of hormonal imbalance. I'll put it on the description box. Now they can prescribe pain relievers for you at that time to help you. And then for surgical cases, fibroids that are interrupting some organs that are big, you have to plan your surgery. There are surgeries that comes as an emergency, but there are some that you can plan beforehand before you come. So surgical case, they open up your womb and then remove it. So it all depends. So just know that there are surgical case to it. So if your fibroid is getting bigger, please, and your doctor says it needs to be removed, please remove it. Don't waste time. Don't do some of these natural things. It depends on natural things. Now comes up if it is small and you're trying to do some things to help prevent it from getting bigger. But when your doctor said it's obstructing, it is in a place where it is not safe for you, it's causing issues, or it's big, please get it removed, because this can cause a lot of harm for you. I've seen it happen in women. They keep on taking these remedies that I will be sharing with you: cloves, black negro pepper, and all of those, over the natural things. But these worsen the condition because it's already so big that it causes them. This can burst those that have cysts. It can burst it open and you start having serious issues that is not necessary. So please, if you're taking all of these natural things like this black negro pepper, cinnamon, or what is it called again? I've forgotten them. I think I'm going to attach a video of how to prepare some of these, and so that you'll be aware. If you're taking some of these, please, you have to be aware and make sure that it is your doctor approves of that and you don't have any underlying medical condition that it can affect. Okay. Now, by the time I'm done with my naturopathic medicine, I'm sure I will help you people in doing most of these things naturally. But for now, I'm still studying it. Naturopathic medicine use herbs to help people heal their illnesses. So for now, I am not done yet. So I can say do this and then tell you their quantities that you're supposed to do. So that is it. Now, having known about this, now let's get to the natural management of fibroids. Like I said, if your fibroid is so big, please have it removed. Your doctor said it is causing problem or it will cause problem in time to come. Remove it. Where you will need this video is to stop it from recurring, or if they just diagnosed you and you don't want it to grow big, or you don't want the one in your stomach to grow big, or you don't even want it, because every woman has higher chances of 50% of women have chances of developing fibroids in their lifetime, before marriage or after marriage. So if you want to prevent fibroids or shrink it if it is still small, please do these things that I want to tell you. Number one thing you have to do is your nutrition. These are the foods to avoid when you are trying to prevent fibroids, shrink fibroid, or you have fibroids already. You have to avoid red meat. Very important. You can take your fish, food that are high in omega-3. Avoid red meat. You can take a little bit of chicken if you want, chicken breast. Red meat, avoid it. Organ meat, please avoid it, because it's going to feed the fibroids because of the estrogen level. Sausages, corned beef, canned beef, whatever form of, especially sausages, you have to avoid it. If not, even if you've done surgery, the fibroid is going to come back. The next thing that you have to do is please avoid complex carbohydrates. What are complex carbohydrates? Example, bread, noodles, rice. You can take brown rice, or a little bit of rice once in a while with lots of vegetables. Don't just take bare white polished rice that way. When you see people that eat local rice, it doesn't mean that they don't have money. Just eat a little bit of brown rice with a lot of beans, and then with vegetable if you must eat rice. So cake, bread, white polished rice, all of those starchy food, starch, all of those things, throw it off the bin. Sausages, meat pie, fish roll, all to the bin. If you do not want to develop fibroids in the future, if you've been diagnosed that you have fibroids and you don't want it to grow bigger, if you are you've done surgery for fibroids and you don't want it to regrow, avoid this food. If you avoid this food, your estrogen level will go down, and the fibroid has nothing to feed off of. Probably it's gonna die off, or it will stop multiplying, or it will just be there and shrink. Please take note of this. Another food that you need to avoid is alcohol. Alcohol is made up of so many types of carbohydrates, complex carbohydrates, fructose, I think, and it is also going to feed the fibroid. Any kind of alcohol. Drinks, carbonated drinks, beverages, sweet drinks, ice cream, all of those things, throw it off the bin. This will increase your fibroid. It will cause more harm for you. Of course, I've mentioned cookies. I'll get to high salty food. So all of these, your ketchup, sauces, pasta, please just stop just throw it off. Cream, salad cream, please. High salted food, condiments, adding a lot of condiments to your food, you are feeding that fibroids. Please stop it. Now, you don't have to take so much coffee. So drinks like energy drinks which have caffeine in them, please stop it. Carbonated drinks, citrus, all of those over-the-counter juices, please, they will increase your estrogen level and fibroids is going to grow, reoccur. Even if you do 200 surgeries, they are going to grow back. Now, very, very important, your skincare products. You have to be careful on the kind of skincare products that you use. Some of these lightening creams, some of these creams that lighten you up, some of them have a compound called EPA, and they mimic, there are a lot of chemicals in them. So this is why women that do a lot of skincare, you buy from all of these people that do organic, you have to be very careful. Get creams that are dermatological proven, and some of these skincare products can mimic estrogen and disrupt your hormones and make your fibroids grow. Now, there are some compounds that are found in some products that I'll be mentioning. There are EPAs, cooking with all these non-stick pots, plastic, warming food in plastic things, food that they can, this EPA can leach, and then you eat them. These chemicals, they can mimic estrogen, and then even if you avoid all of these things, make sure that you are very, very careful with what you put, with the cream you use, with the soap you use, with your environment, using lots of perfumes, lots of body sprays, nail polish. These things can have effects on you. They can mimic all of the time. Using all of the time, it can increase and then increase your estrogen, and then mimic estrogen, and then your body starts reacting to these things. Now, especially relaxing your hair, any form of relaxer, you just need to avoid, especially if you want to prevent fibroids. Now, it is very important to note that estrogen is like a fertilizer. Your body, estrogen makes anything in your body grow. So when it is increased in your body, your fibroids grow. Okay, so this is why when you avoid these things that can increase your estrogen level from your diet, your fibroid has nothing feeding on it and it will shrink. So you have to be very careful. Okay, so now the other thing is hormonal birth control. Hormonal birth controls like hormonal pills, vaginal rings, intrauterine device. These things are loaded with hormones, estrogens, and these things can make your fibroids grow. This is very, very important. So if you're a lady and you are always abusing over-the-counter, emergency contraceptives, please stop it. So these hormonal things for preventing pregnancy, the depot shots, all of these things, they are packed with hormones, and they can increase your estrogen level and the fibroids grow. So you see, when managing fibroids, everything has to be natural. I mentioned the things I mentioned initially because of science. That is what science taught us. So in as much as I'm studying naturopathic medicine, I'm also a registered nurse. Everything is scientific. So, but you should know that estrogen makes is like a fertilizer. It makes everything in your body grow. So please be aware. I wonder those that have not been watching this video from the beginning, they may be lost. Okay, so now having said about this, I hope I mentioned donuts and also all of those highly processed food. You have to avoid it because they can make your fibroids grow. Now, another very important one is stress. Please, you have to rest, because if you're stressed, your body sends a signal that you need more, insulin will be produced. You can add weight. Estrogen triggers your fat body cells, to produce more fat for you to have more energy, and hormonal imbalance occurs and fibroids is fed. Okay, so please try as much as you can to have adequate rest, especially at night. Okay, you have to do exercises, but you won't have to overwork yourself. So do exercises, walk, brisk walking, jogging, weightlifting little. Don't stress yourself, so that your adipose tissues, insulin levels will be normalized, your hormones will be regulated. And in fact, most of the times for people having hormonal imbalance, once you start inculcating all of these things, you will see that your period will return. Everything will just go back to normalcy. Locate the video of hormonal imbalance if you've not watched hormonal imbalance video. Now, the next thing on the list is, I've mentioned salts. Salts. Please don't eat high food that are high in salt. Okay, so you can focus on the Mediterranean diet. Now, the Mediterranean diet is all about whole foods, like I mentioned, grains like beans and different kind of grains, millet, herbs and spices. Herbs like ginger, garlic. I will mention the herbs that you can take and explain each of them one by one. I just hope this video doesn't get unnecessarily long. Herbs like ginger, please, you have to take ginger if you are having fibroid, if you want to prevent fibroid. Ginger, garlic, turmeric, these are all good. Seeds like almond nuts, sunflower, pumpkin seeds, nuts. These are things that if you're looking for what this is what the Mediterranean diet contains, then lean meat, fish, salmon, red meat off the table. So that is all about it. Please, again, avoid packaged food, biscuits, all of those things. Now, the next point on the list that can help you deal with fibroids naturally or even prevent it is, or treat it as well, is green tea. Green tea is high in antioxidants. It prevents inflammation in your system and also helps reduce that estrogen. Green tea is a very potent antioxidant that can help you. So because of the antioxidants, the green tea can slow the growth of fibroids by reducing inflammation, like I said. It also reduces the high estrogen levels in your body. Now, so try as much as you can to, have your green tea. Please cut back on alcohol. Like I've said, alcohol, you can't have fibroid and you're taking alcohol, or you want to prevent fibroids and you're taking alcohol. And the next one is, please try to lose weight, especially around your stomach. The next one is, I think, vitamin D. Yes. Before I forgot, alcohol increases those hormones that will make your fibroids grow. So alcohol can increase your risk of having fibroids if you are taking alcohol as a woman. Like I was saying initially, vitamin D can help shrink fibroids by 32% according to studies. So please make sure that your doctor checks you and know if you're at any vitamin deficiencies, because this is very important in fibroid management. So I think that is all you need to do. Onions is also very good for fibroid. Remember the herbs I mentioned: onions, garlic, ginger, turmeric. So for the other ones, those herbs that people cook, negro pepper, cloves and all, I can't say anything about it right now. Like I said, I'm not yet a certified naturopathic doctor, so I don't do what I'm not certified to do. However, using these remedies, you have to be careful. Now, all of these advices I've given you, remember, I am not a gynecologist. These are also based on studies. Okay, so I think that is all of it. Remember, if you want to talk to a gynecologist, you want to talk to me, just chat the number on the screen. If you need a meal plan of fibroids, a guide meal plan for fibroids, just chat the number on the screen. Tell my secretary that you need a meal plan for fibroids, or you want to talk to Nurse Merit, or a meal plan for fibroids, then I will tell them what they need to do. Please, it's not free because I'm not the one preparing it. It's actually the dietitian that will be preparing it for you. So let me know if you have more questions and put them in the comment section. Have a nice day. Please like, share and subscribe.